In this video, I'm going to share pharmacology study tips that are going to help you ace your pharmacology exam. Stay tuned. What's up, you guys? Welcome to my channel, Nursing with Key, where I make a whole bunch of nursing related videos, sharing tips and tricks that I've learned along my journey to help you guys have the smoothest nursing journey. I'm officially making this video. I've gotten a lot of messages from people who wanted me to make a video on how I study for pharmacology. I also made a poll recently where a lot of people voted for, sorry for that, the sun just kind of disappeared. But a lot of people voted for this video, and so I'm making it for you guys. But before we start, I need to thank you guys so much for helping me hit 5,000 subscribers. That is major. I remember just the other day making my my video thanking you guys for 100 subscribers, and now I'm at 5,000. So thank you guys so much for that. And to celebrate my 5,000 subscribers, I have a little special giveaway that's also related to this video that I think you guys are really gonna like. So for those of you guys who have been with me from day one, you guys have probably seen these two books. These are two Saunders nursing drug books. I did a giveaway. Well, I attempted to do a giveaway in my nursing must-have videos when I hit 100 subscribers, and I was giving away these two books. I did have people who hit me up for the books that participated in the giveaway, and I did mention the winners in my following video, but they never hit me back up with their information, and so I was never able to give the books away. So since we're on the topic of pharmacology, once again, I'm giving away these two books. I have never used them, but they were given to me for free. And just because they're 2015, guys, don't be fooled. Don't think that they're not good. The only difference, like, there's new editions coming out every year, and the only reason why is because new drugs come out every year. But all your essentials, all your popular drugs, every single drug that you could find, almost every drug that you could find in the 2016 or 2017 edition is in here, except for the new drugs that come out every year. So if you guys are interested in getting these books, make sure you subscribe to my channel. Make sure you follow me on Instagram and send me a DM explaining why you think you should be the winner of this book or why you want this book. And in my next video, I'll be announcing the winner, and I will be sending you guys these books off for Christmas. So stay tuned. Now, like anything, if you guys are into The Secret and paradigm shifts like I am, you guys know the importance of repetition. It's all about repetition. In order for you to remember your drugs, you have to see them a lot, you have to study them a lot. Now, there's so many drugs that we were taught in pharmacology that I kind of forgot before it was time for me to go on my rotations, but now I'm starting to remember them a lot because I'm on rotation, I'm giving them a lot, I'm seeing them a lot. And if you've ever seen an MAR sheet, you'll see that they'll have the medication, the generic and the brand name of the medication, and they usually have the side effects and the classification of the drug. So by seeing that all the time, I'm starting to learn my medications. And also when you're on clinicals, your teachers, well, my teachers anyway, they always have me do a medication research before I administer medication. So they will give me the list of medications that my patient has, and I will have to know the classifications, study my drugs, know them by heart before I can administer them the following day. So repetition is important, and so I'm going to teach you guys how I was able to study. These are empty ones, but cue cards. Cue cards are really good way to study, and you don't just have to have them in your binder and then just look at them when you feel like. Stick them all over. Stick some of them in your car. Stick one of them in your trunk, so when you go grocery shopping and you're putting stuff in your trunk, boom, your cue card is there. It reminds you. Stick one of them on your window so that you see it every day. Stick one, I don't know, in your glove compartment so when you open it, you see it. Stick them all over the place. Stick them in your room. Stick them all over. Repetition is key, and by seeing the same thing over and over again, you're bound to remember. So start sticking your cue cards everywhere, and don't just get rid of them when you've passed pharmacology. Leave them where they are. The second thing is to make posters. Now, I had a poster before that I made, that I hung up onto my wall, but then I kind of revised the information that I put on it and realized that some of the information I put on it wasn't really accurate, and so I'm in the process of making a new one. But here I have all my heart medications, and I try to do little pictures. Like, I know that these are all my heart medications because I have a little heart next to them. So I have my beta blocker, I have my ACE inhibitor, my calcium channel blocker, and my angiotensin receptor blocker. I also have my diuretic and all my other stuff that I need to add into that. But when I'm done making my poster, what I'm going to do is I'm just going to hang it on the wall in my room. And just by seeing it all the time, it doesn't have to be conscious, just subconsciously by seeing it all the time, the information is going to register into your mind. So make yourself a poster with, ask your teacher a list of medications that they really, really want you to know. Make a poster, hang it up in your room, and study it every day. Now, another trick that I want to show you guys is suffixes and prefixes. Now, I'm going to show you guys 4 suffixes that are related to antihypertensive drugs, and just knowing these suffixes, you're gonna know like 200 meds off the bat. So, beta blocker. Beta blocker usually end in the suffix alol or olol. So if you see an olol or alol drug, you know that it is a beta blocker. As you can see here, I wrote beta blocker, and then I put suffix olol / ALOL, and I put a laughing face. So I have my olol, and then I have the disorders that it's that this drug is used for. So you have heart failure, hypertension, angina, and mitral stenosis. Then I have the action, so it slows the sinus heart rate and lowers blood pressure. And then I have my clinical, so it's an antihypertensive and an anti-angina drug. And then I have little examples here. Example, metoprolol, and then I put a little square around the LOL. So metoprolol, bisoprolol, and all of that. And then I have my side effects and my nursing intervention. So what I have to do as a nurse, so you have to check your pulse and your BP and make sure that your systolic number isn't under 90 and that your pulse isn't under 60, because you know that beta blockers work directly on the heart, and so they make your pulse plummet. And if somebody's pulse is under 60, you don't want their heart rate to plummet if their baseline is too low. So I did that for all of them. Beta blocker we covered. The suffix for ACE inhibitors is pril. So perindopril, benzapril, enalapril, things like that. Then you have your calcium channel blockers that finish in pine. So amlodipine, felodipine, nifedipine, all of that. And then you have your angiotensin receptor blockers that finish in tan. So azosantan and candestan, and am I even saying that right? Candestan. And all of that. So I think that you guys should really make a poster like this, hang it up on your wall. And the thing I spoke about in my study tips video is recording. Even if your conscious mind isn't registering something, your subconscious mind will register it, okay? Your brain continues to register, medication. Your brain continues to register information even in your sleep. So record yourself reading the drug that you need to know and play it in your sleep. Play it in your sleep. Play it on in your car on your way to work. Listen to it in your headphones at school. Listen to it during lunch. Listen to it all the time. Every time you have free time, listen to it over and over and over again, and you're bound to learn them. Lastly, I'm going to tell you guys a must-know thing, okay? Know your insulins. Know your insulin. Know how to administer your insulin. Remember that clear always comes before cloudy. So when you're drawing from your syringe, clear always comes before cloudy, because the cloudy one has proteins in them, and the protein in it is what makes it long acting. So if you put your syringe in the cloudy drug first and then you put it into your clear, it's going to contaminate your clear, and your clear isn't going to have the effect that it's supposed to have. So always remember that you put your air in your clear, then you put your air in your cloudy, you draw from your cloudy, and then you draw from your clear. Do not contaminate the clear with the cloudy. If you remember that, do not contaminate your clear with your cloudy, you should be good, okay? Know your insulins, know your peak times, know your onsets, and know your signs and symptoms of hypo and hyperglycemia. That's another very, very big thing when it comes to pharmacology. And also know your formulas. Make sure you know your formulas. I'm not really going to go into the whole teaching thing. I'm nowhere near being a pro, and I don't want to give you guys false information. But what I will do is I will give you guys a link to another YouTuber who's amazing. She's an RN. She's an awesome teacher. Her YouTube name is Registered Nurse RN. So I'm going to put it up here. She has every single video you could possibly think of that will help you with studying. So make sure you go check her out. I really hope you enjoy the video. Don't forget to like, comment, and subscribe. And like I said, make sure you follow me on Instagram or on my Snapchat, which I will link somewhere here. And I will also leave in the description box below. Tell me why you want to win these books. And this will be my Christmas gift to you. I hope to see you in my next video. Bye.